Welcome to CareTalk, your virtual home for insightful discussion on COVID-19. I'm David Williams, President of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. David, we're in the midst of this COVID-19 epidemic. How can the United States, which spends twice as much per capita on healthcare as any other industry, not have enough beds and ventilators?
John, you'd think that we would have enough, but we don't. And the answer is actually fairly simple. Nobody has a policy in place to deal with surge capacity, and the private organizations don't have an incentive or ability to do it. If you look at what we do from a military standpoint, an explicit strategy to say we're going to spend enough to have, to be able to fight 1.5 or 2 wars. There's nothing like that in healthcare.
But what would that surge thing mean?
Well, so, it might surprise people to know that we don't have as many beds or doctors. If you look at a place like Germany that has 4.3 doctors per 1,000 people compared to 2.6 here, or Italy that has 4, and they have more acute care beds too. Germany has 6.1 per 1,000 and Italy 2.6, and we have 2.4. It's actually an explicit decision to do it. And you could just build extra hospitals and have the space and just have it available and have the lights off and turn it on when you need it.
But how can they have more doctors and more hospital beds and cost less? Explain that to me.
Yeah, well, partly, frankly, it's we pay people more in the U.S. So that one of the reasons is that you spend less is because you spend more per unit cost here. But the other thing, the reason, and look at the capacity, is a little bit misleading, and I think this is one of the ways that we can potentially get out of the problem with a little creative thinking. So we do a lot of outpatient work in the U.S., which is by design, as opposed to going to the hospital. And so maybe if we actually look around at some of what we've got out there, again, not centrally planned, not really strategically, but things like ambulatory surgery centers, nursing homes, even what's happening at home, machines that people have for sleep apnea. There's more capacity there out in the system, and we just have to flex it in a different way.
But I agree with you there that we could do a lot more with home health, personal care assistance, empowering patients and their families with digital tools. That's what CareCentrix is based on. But the enormously frustrating thing for me is no one's planning on giving those resources, the technology and the supply chain to support it. And that even after Hurricane Katrina, that after major storms have devastated certain areas, whether it's New York or New Jersey or different islands, that we haven't built the surge capacity, the flexibility to supply and care for people who are hurt. If you built that into the system, and particularly in a time of climate change, it's just stunning that when you talk surge capacity, what I first start to think of, make sure you've got as a system enough supplies in the same way that as a house, you need enough water to actually keep the system going. It's enormously frustrating.
I think you're right, but imagine saying, okay, we're going to pay for everything we're paying for now, and then we're going to put actually even additional investment. It probably one reason people didn't think about it is you figure, well, for $3 trillion, there must be plenty of extra available, but it's really not the case. But as long as we're talking about capacity, the average capacity or the total number of things doesn't always matter as much as what the pinch point is or where the constraint is, the bottleneck. And if you think about now, we're talking about having enough ventilators, but you need ventilators, but you also need places to plug them in, beds for them, but you also need things like sedatives, so someone can be sedated while they're intubated, and we may well run out of those. So you really need to be doing planning, not just at the level of how many ventilators, how many beds, but really looking at where the new choke point is going to be.
Well, we beat up Donald Trump a fair bit, or at least I do. He's your pal. But I think one area where he's clearly right, and we're seeing it in the pharmacy supply chain, is a lot of the critical components that we need to actually build the drugs are manufactured, and too many of them are manufactured in China. And at a time when particularly China and India are still suffering from this pandemic, they're a lot less interested in sharing their manufacturing capacity with us. And that Buy America probably needs to start with emergency medical supplies, and particularly pharmaceuticals that are critical, particularly when something like this hits.
Well, I know you don't want me to do any more bashing, but I will say that I think short-sighted policy toward China in this trade war is part of it. So, we're putting tariffs on all of these goods. We're basically telling people to move their supply chain. We're right in the middle of that. So they're brittle. And there's not a shared commitment to long-term interaction of global trade like there was back in the 2008 financial crisis when we actually coordinated the stimulus. And therefore, China's saying, well, what the heck? They don't want to buy from us anyway. Why should we go the extra mile?
But I mean, it seems like a diplomatically shooting your own foot. If on one day you're attacking China, which, let's be honest, they weren't straight with the COVID virus when it started to blow up over there. But when you need them is not a time to attack them. You raise a really interesting point that President Bush during the time of the '08 crisis was tightly coordinated with Hu Jintang, who was actively working to sort of collaborative the industrial economies back, which was good for China and good for the U.S. and frankly helped save Europe. There's no relationship like that. There's no working relationship at a senior level where we're coordinating. We're really criticizing. It's unfortunate.
So I think when we come out of this, what we will need to do is to find a way to build some surge capacity into the system. I like your idea of a health core of people that can actually kind of rush in and help out and be leveraged by highly skilled people that are doing it permanently. I think we need to consider our assumptions about supply chain and this whole just-in-time approach may not be workable. You may need more backup. You may need more supplies closer and some other kind of flexible capacity. So, right now, there's a bunch of places like the ambulatory surgery centers. They're not doing any business right now because elective surgeries aren't happening. Primary care offices aren't being used either. And if we thought ahead of time about the potential to repurpose those, maybe that would make a difference without going from $3 trillion to $6 trillion in terms of cost for healthcare.
Well, it's really taking the responsibility of leadership to look at our healthcare organizations as part of one system that needs to care for Americans. And the second thing is you just got to acknowledge that bad things are going to happen. I mean, we've had enough hurricanes or major storms, and this is the most extreme example, but we have to plan for caring for folks in a crisis. And that's what that would require.
No, I think fair enough, John. And just to bash Trump one more time, I guess when we looked at Puerto Rico and saw him going out there and throwing paper towels to people, we said, well, that's just Puerto Rico. But now you're in Massachusetts and New York, it feels like just the same.
It does. And honestly, we failed the people in Puerto Rico and now we're failing the people in New York, and he should be held accountable. I agree with you. But let's try to think about the solutions and not the politics right now.
Very good, John. Well, on that cheery note, let's wrap up this edition of CareTalk, where we've been talking about COVID-19. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for listening.
Hey there, listeners. Want more CareTalk? There's more to be had in our other episodes, so be sure to look for those and subscribe to CareTalk on your favorite service.